study showing that more people around the world are dying after undergoing surgery than they are from HIV, TB and malaria combined. Post-operative complications are now the third highest cause of death worldwide. Half of these occur in low and middle income countries. Well, to help us understand this and tell us more about it is Professor Bruce Bickard from the University of Cape Town's Department of Anesthesia and Perioperative Medicine. Prof, good morning, and thank you very much for your time. Just to understand this, I mean, when I saw the headline, more die after surgery than from HIV, TB and malaria combined, I thought surgery was performed to save people's lives.
Yes, you're correct. Morning. So surgery is extremely important. I think we need to put this in context. It's an important component of public health and global health. And people with surgical conditions do better. They live longer if they have surgery and they have a better quality of life. But, you know, surgery, like all patient care, is associated with complications. And sometimes these complications lead to death. I think the importance of this study is understanding actually how much surgery is going on and how much mortality is associated with surgery. So really we need surgery to make global health better. But what we need to do is actually we need to spend more resources on making surgery even safer. So for us in low middle income countries, this is really important because, you know, about 90% of patients don't have access to surgery, and if they do get access to surgery, then they're twice as likely to die when compared to high-income countries. So we would hope that this focuses attention on surgery, you know, especially with it contributing more to mortality than HIV, TB, and malaria, as you correctly said.
Yeah, what could be driving these deaths? I mean, according to your research, about 4.2 million people die every year within 30 days after surgery. So they've accessed surgery. It hasn't helped them. What is leading to the deaths?
So the commonest cause of deaths following surgery are infections associated with surgery. But there are other causes such as kidney disease, bleeding, etc. So the reality is the message mustn't be confused in that surgery is really necessary and it improves lives. It's just the volume of surgery. You know, we're talking over 350 million cases per annum globally. And if we increase access like we should, probably 500 million operations annually globally. And that's why actually you see surgery contributing such a big proportion to mortality globally.
Okay, you talked about access, and that is important to provide the service because, of course, it's got a duty. However, the quality of the surgery might also be at issue then.
Yes, certainly. I think when you talk about, for example, low middle income countries where we know mortality is double high income countries, it's not necessarily quality alone. It's a very resource limited environment. And what happens is, I think a lot of times patients develop complications which usually could be treated, but because of the lack of resources and human resources, some complications are missed and patients die. So really, we need to find ways of identifying patients who have complications early, and we need to be able to address these complications early so they do better and realize the benefits of their surgery.
Okay, now, Prof, before I let you go, very briefly, what kind of investment do you think can be done to improve the quality then of surgery around the world, particularly then in countries like ours, what we are part of the low and middle income countries?
That's a great question. If you think how much resources are invested, for example, in HIV, TB, and malaria, one would expect that equivalent amount of resources, at least or more, should be invested in addressing surgical safety, especially as it contributes so much to global mortality.